In this video, we will talk about the Federal Employee Health Benefits FEHB program. During this training, we will outline key times you can enroll or modify your health insurance, show you what documentation is required or conditionally required, as well as where and how you can submit that documentation, explain recent OPM requirements for proof of family eligibility, describe other benefits programs and how to enroll, and finally, we will conclude with a portal demonstration. Please note that this microtraining does not cover specific health insurance plans. You may choose from a wide selection of health and benefit programs during onboarding, during open season, or if an eligible qualifying event occurs. As a new hire, you may submit the Health Benefits Election Form, SF2809, along with supporting documentation for family member eligibility as part of your onboarding process. You may either provide your local HR staff with your completed health benefits election form and supporting documentation on your entrance on duty date, or you may submit this form via the portal within 60 days of your EOD date. Please note, if you do not elect coverage within the first 60 days of your EOD date, you will be considered to have waived coverage, and you will need to wait until the next open season enrollment period to elect coverage. As a transfer, FEHB, in addition to several other benefits, will transfer with you. You are not able to alter your elections during the transfer process. For more information on the onboarding process, please visit the Onboarding Knowledge article. Open season for health and benefits coverage is the period for you to confirm that you have the right health insurance coverage for you and your family. During FEHB open season, anyone eligible to participate in the Federal Employee Health Benefits Program may enroll, change health plans or options, cancel FEHB enrollment, or change participation in premium conversion. Premium conversion is the reduction in an employee's taxable income by the amount of their health insurance premium. The changes you elect during open season will be effective in pay period 1 of the following calendar year. Outside of open season, you may update your health insurance due to a qualifying life event, or QLE. A QLE is a life event under the FEHB program that allows you to modify your coverage outside of open season and includes marriage, divorce, death of a spouse, or addition of an eligible child. Please note, if you are adding a family member to an existing self and family enrollment, you must provide proof of that family member's eligibility for coverage. If you experience a QLE, you are eligible to make changes to other benefits 30 days prior or up to 60 days following the event. The documents you need in order to take action on your health insurance, either enrolling in, changing, or ending your health insurance, vary based on your intention. For example, let's say you want to modify your FEHB. Regardless of the reason, you'll need to fill out the SF2809 form. Then, the conditionally required documents change based on your situation. If you want to add a family member who was not previously on your health insurance, you will need to submit supporting documentation to prove their eligibility. If you experienced a qualifying life event and are modifying your coverage as a result, you will need to submit proof of that QLE. If you received a mandatory enrollment court order requiring that you, as a federal employee, provide health benefits to one or more of your child or children, you will need to submit that court order or proof of alternative coverage. The where and how of taking action on your health insurance, either enrolling in, changing, or ending your health insurance, vary based on your situation. If you are enrolling as a new hire, modifying, waiving, or terminating coverage, you can take this action on the Enterprise Services portal using the FEHB Federal Employees Health Benefit Enroll, Modify, Terminate Service Request page. On that page, you can choose the option Enroll, Modify, or Terminate depending on your intention. If you are enrolling during open season, you can take this action through the Employee Personnel Page System, or EPP. You will follow the instructions on EPP to choose the right plan for you. If you are unable to access EPP, you can also use the FEHB Federal Employees Health Benefit Enroll, Modify, Terminate Service Request page on the portal. The SF2809 is a key form in the health insurance process. It is used to switch designated eligible family members, enroll or re-enroll in the FEHB program, or to change, cancel, or suspend your FEHB enrollment. In the next 3 screens, We will call out key aspects of the form. The first 12 items of Part A are filled out by you, the employee. You can complete the identical subsequent sections for qualified dependents as applicable. For relationship code on the top right, refer to the relationship code table on the screen. Complete Part B, FEHB plan you are currently enrolled in. Please refer to your current plan documentation. Complete Part C, FEHB plan you are enrolling in or changing to. Select your desired plan. Provide plan name and plan code found on your state's plan information page. Provide the 3-digit enrollment code as outlined on the cover page of each plan brochure. Complete Part D, event that permits you to enroll, change, or cancel. Select the event code directly from the SF2809 according to the situation you are experiencing, even if you have previously waived premium conversion. Use code 1B to designate open season only. Current federal employees should not select 2 series codes. Complete Part E, election not to enroll, if applicable. Complete Part F, cancellation of FEHB, if applicable. Complete Part G, suspension of FEHB, if applicable. Complete Part H, signature. Sign and date to authorize enrollment and applicable deductions. As of July 2021, the Office of Personnel Management requires proof of family eligibility when adding a new family member to an FEHB plan. See the examples on the screen for the type of documentation that may establish family member eligibility for FEHB coverage. The enrollee may remove personal financial information and Social Security numbers before submission, and non-English documents must be accompanied by a translation. Here are some more examples of other family relationships and the supporting documentation that would determine their eligibility. Feel free to pause this video to read more in detail about the documentation requirements. There are other benefits programs available to federal employees during open season. These are not requested in the Enterprise Services portal. Federal Employee Dental and Vision Insurance, FEHB. FEHB is available to eligible federal and postal employees, retirees, and their eligible family members on an enrollee pay-all basis. Enrollment takes place during the annual federal benefits open season in November and December. New and newly eligible employees can enroll within the 60 days after they become eligible. For additional information, please see the Office of Personnel Management's Dental and Vision overviews. To enroll in FEHB, please visit benefeds.com. Federal Flexible Savings Account Program, FSA Feds. FSA Feds allows you to save money for healthcare expenses with a healthcare or limited expense healthcare flexible saving account, FSA, through the Federal Flexible Benefits Plan, FedFlex. Unlike the FEHB program, enrollment in a flexible spending account, FSA, does not automatically carry over from year to year. An open season is held each year at the same time as the federal employees' health benefits open season, during which you can enroll in an FSA for the following year. You must choose to enroll each year during open season. New and newly eligible employees can enroll within the 60 days after they become eligible. For additional information, please see the Office of Personnel Management's Flexible Spending Account overview. For FSA Feds questions or enrollment, please visit fsafeds.com. Health Savings Accounts, HSAs. HSAs are available to members who enroll in high-deductible health plans, HD-HP. Enterprise Services does not establish HSAs for eligible employees. These allotments are instead established through your HD-HP. For additional information, please see the Office of Personnel Management's HSA overview. For HSA questions or enrollment, please contact your health provider. Now we will transition to the Enterprise Services portal and demonstrate how to enroll, modify, or terminate FEHB. Welcome to the Enterprise Services portal. Today, we'll show the process of modifying FEHB as a result of a qualifying life event, a marriage. To get started, select Request Services on the service bar. Next, select Benefits. Then select FEHB Federal Employees Health Benefit Enroll, Modify, Terminate tile. Here we can scroll down to review the instructions. The third table here is the one that applies to me. I will need to submit the SF2809 as well as proof of QLE and supporting documentation for family member eligibility. Select the SF2809 form. Here you can see instructions for how to fill out the form, many of which we covered in the previous slides. Download the document. On page 17, I fill out relevant information, including information about my new spouse in items 13 through 21. Next, save the document for uploading. Collect other documentation, such as a government-issued marriage certificate. Return to the service request page. On the request page, choose the request type, in this case, Modify. Choose the request subtype, in this case, Due to QLE. Next, provide a comment. Using the Add Attachment link at the bottom of the page, upload the relevant documents. Again, at this point, I would submit other documentation, such as a government-issued marriage certificate. Select the checkbox acknowledging all documents are attached. Finally, select Submit in the top right corner to complete the submission process. Once you submit, a ticket will be opened for you. Enterprise Services will process the action and will also use the ticket to communicate with you, including status updates and requested actions, for the duration of the process. To learn more about how to track your tickets and what type of notifications to expect, please refer to the Service Request 101 Knowledge article. For more information on FEHB, see the Health Insurance Knowledge article. Thank you for joining us today. Check out more resources on the Enterprise Services portal.